hand contact. They both work just fine. The direction that we're pushing is going to be A to P and a little bit of M to L, because we need to open up the innominate like this. First thing you do is ask the patient, are you ticklish? Okay, are you sure? All right. If the patient's ticklish, then we put the patient's hand over their ASISs, the meaty part of their hand, not their fingers. If the patient's not ticklish, put your hands right there. That's fine. You gotta you have to get used to asking that. If they're like, nah, they are. Just put their hands there. We put the hands there mostly as a barrier. And then I've been taught, like especially in massage school, we were taught patients can't tickle themselves. Yeah, you probably can. If you're really ticklish, like I've had patients tickle themselves. You put this here and they're still squirming on the table. I mean, I don't know, have you met those patients or those people that, I mean, I could be across the room going, I'm tickling your hip right now, and they just go nuts. Right? It's just, some people are really ticklish. So you have to ask about that. What would you think, if I'm distracting the SI joint, where would you think symptoms might be provoked? SI joints, back here. If it's painful where I'm pushing, that might be, I mean, it's something to pay attention to, but it's not a real positive here. So I like to cross my arms. One ASIS, the other one right here. I like to cross my arms because I'm pushing medial to lateral like that. So now you have jeans on, I want to check. Rivets. If they're right over the ASISs, be careful. It doesn't feel that good to have somebody, I'm going to be putting all of my weight into these ASISs. If I do that and put one of those rivets in the ASIS, it's not going to feel that good.
So if they do have used service, do you have them put them down? Or
no, you just move them over. You can move the rivets over. I just make sure I'm not on top of them. You can have them put a gown on if you want. I lean in with my body weight. Notice how I'm doing that. My center, my pelvis is moving towards my hands. Notice my shoulders are nice and stable. They're not up in the air like that. And then once I lean in with my body weight and I take all that tension out of there, I just oscillate. I want to wiggle that joint tension. See how it feels. Any pain with that?
Are you doing that?